But COVID is still with us. After 3 years of the pandemic, what did we do right? And what did we do wrong? And how prepared are we to fight the next unexpected outbreak? That's our focus on COVID-19. What did we learn? Next.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome to COVID-19, What Did We Learn Town Hall. I'm Olga Villaverde, and joining me is Dr. Michael Zinner, CEO and Executive Medical Director of Miami Cancer Institute and Baptist Health Cancer Care.
Thanks, Olga. You and I have done a number of COVID town halls since the pandemic began, but it looks like things are getting back to normal. And while COVID has not gone away completely, we may be seeing light at the end of the tunnel.
And that is good news, Dr. Zinner. The World Health Organization recently announced an end to the global health emergency. Take a look.
For the past year, the Emergency Committee and WHO have been analyzing the data carefully and considering when the time would be right to lower the level of alarm. Yesterday, the Emergency Committee met for the 15th time and recommended to me that I declare an end to the public health emergency of international concern. I have accepted that advice. It's therefore with great hope that I declare COVID-19 over as a global health emergency.
Now, while that's good news, it's important to remember all the lives we have unfortunately lost. Look at the numbers. There have been 800 million confirmed cases of COVID-19 worldwide. Almost 7 million people have died from the virus, and 1 out of 6 of those deaths were right here in the United States.
We have a lot to discuss, what we've learned, what we did right, and what we did wrong.
So let's start by introducing our panel. We have Dr. Carlos Del Rio. He is the Associate Dean of Emory University School of Medicine. Dr. Scarlett Constant, the head of Constant Care Pediatrics in the South Florida area. And Dr. Kenneth Alexander is the chief of the Division for Infectious Diseases at Nemours Children's Health in Florida. I want to welcome all of you to the program. Thank you so much for joining us.
Thank you for having us.
Now, before we begin, Dr. Zinner, I want to remind our viewers that if you have any questions for our panel, please send it to us. We have the information right there, questions@allhealthtv.com. That's questions@allhealthtv.com. We'd love to hear from you.
Dr. Del Rio, let's begin with you. How does the World Health Organization declaring the end of a public health emergency affect your patients and you as a physician?
Well, thank you, Michael. I think more importantly than that, what the end of the public health emergency by WHO affects my patients is how the end of the public health emergency by the U.S. government affects our patients. Because really, that is really what impacts ourselves and our patients. And, you know, the public health emergency ended a few days ago here in the U.S. And there are certain things that are not changing. There are certain things that are changing. I would say for now, the things that are changing is, for example, how surveillance is done. The states are no longer required to submit laboratory data to CDC. So CDC is looking at different ways of doing surveillance. They're going to do it through hospitalizations, through death, and most importantly, through wastewater surveillance. The second thing that changes in a significant way is that the additional money that hospitals used to get, the additional permits hospitals used to have to do things like, you know, building ICU beds and parking lots and other things, that goes away. It also goes away. States can now start thinking about who do they have on Medicaid, and they'll be able to get people off their Medicaid rolls. So therefore, the number of people who are uninsured are going to go up. And most importantly, you know, no longer do you have access to COVID-free testing. Although I've learned that for the next several days, you can still go to the government website and get for free your COVID test. So if you want to do that, you certainly can do that. What is not going to change is access to vaccines, access to treatments. The government has bought enough supply of vaccines and enough supply of antivirals that for the time being, you will continue to get them for free as long as the supply lasts. Once the supply ends, then it'll be up to your insurance, it'll be up to your payer. And one of the things the government has done is if you're a Medicaid beneficiary or if you're underinsured, that they will continue to provide funding at least through September of 2024. So some things are changing, some things are not changing, but people really need to realize that on the overall things, nothing changes for you individually.
Thank you, Dr. Del Rio. Dr. Alexander, let me turn to you. Should there be a concern that people may think that COVID has gone away for good and they don't need to worry about it anymore?
So this is actually an important point. Really, what's happening both from the WHO and from the federal government is that they're saying COVID is no longer new. We understand it. It's now a part of our lives. They're not saying it's gone away. And I think we can freely anticipate with the emergence of different variants that there's going to be both spot fires of COVID and maybe even eventually a seasonality like influenza. But I think the other thing that people need to keep in mind, people will say, well, COVID is now endemic. It's a part of our lives. Endemicity is not a promise of mild disease. I mean, malaria is endemic many places in the world, but it's not mild. It still kills people all the time. So I think while we are changing our approach to COVID, that doesn't mean we need to let our guard down.
Dr. Constant, the pandemic really put a focus on health and economic inequities. But some gains were made through enhanced social programs like expanded Medicaid and CHIPS, the Children's Health Insurance Plan program. Will the ending of those benefits hurt the underserved communities?
Well, sure. If there's a decreased access to a sufficient medical care and access to physicians, then absolutely that would affect them. It was hard enough to get people to get to the doctor and get tested and convince them to get the vaccine in the first place when they had insurance and when these things were offered for free. So I think this would have a negative influence.
Thank you, Dr. Constant.
While there were things we did quite well during the pandemic, we have to admit many mistakes, and bad decisions were certainly made.
And there's still a lot of debate about that, Dr. Zinner. We actually sent a camera crew out to a local Rotary Club luncheon to get people's thoughts. And one gentleman, Dr. Zinner, was concerned about two issues. Let's take a look.
Consequences of COVID, there were two that brought to my attention. First was the different reactions of different states and communities to COVID. That's not a bad thing, and we need to examine what worked and what didn't work in retrospect, see if we can improve our responses should another pandemic come along, which undoubtedly it will at some point in time. The other question was children. I was deeply concerned by the loss of educational achievement by kids who were isolated or who were actually kept out of school altogether during the pandemic, and how can we address that loss so that we don't have further academic losses when and if the next pandemic comes along.
Dr. Constant, we know there's been an impact on children's emotional and physical well-being. What can we expect for the future of that generation? And I'm even thinking about my own grandchildren here. Dr. Constant?
Right. That's a great question because there is an age group that was severely affected during this time with the isolation, of course, and, just the overall stress that was, underlying in the household for everyone. And I think that moving forward, it's communication is always important. We need to have an open dialogue to kind of what we're discussing now, learn from what happened and how we could have done better, even as a family. Sometimes I sit with my husband and we talk to the kids and we think about our COVID response and how we could have responded better, what we could have done differently, how we could have avoided certain things. So I think the way to move forward is to really discuss, how we could prevent this from affecting us so severely again. And as far as the kids that were isolated, while that was definitely a huge impact on them, we have to remember that the isolation was multifactorial. It wasn't just the pandemic. This was starting before the pandemic. This behavior was starting long before the pandemic with the video games and the chatting and the devices and the individual games that they play with each other, and they're not meeting to play outside anymore, and they're not having, they weren't doing that long before quarantine. And then what happened with the quarantine was the one bit of socialization they had, which was attending school, that final piece was taken away, and then lights out, total isolation. So I don't really like that we blame this whole thing on the quarantine and the pandemic. It really was brewing for a while. So we need to reevaluate our entire social situation and how we're raising our kids, and not just blame it on, basically a 1.5-year stint where we had difficulties going to school.
And Dr. Constant, I am so glad you brought up those points, and I cannot agree more with you on everything you have just said. Dr. Del Rio, chiming in on what Dr. Constant just talked about, the schools and the closings. The gentleman in the video mentioned it, right? And we all know that school closings were different in various states. Any lesson here?
Yes, I think, Olga, the main lesson is that you need to think carefully about school closures. And when you close schools during a pandemic, you need to keep them closed as short as possible and do everything you can to get them open back again. And I think that, to me, is the most important lesson out of this pandemic. Getting children back to education, getting children back to school when we knew we could do it. And there are many school districts who implemented testing, who did a variety of things, and got kids back to school. Schools that stayed closed for way too long, I think it really impacted the educational attainment of those kids. So I think looking at closing schools for as short as possible is probably the most important lesson we can take about school closure. I would say that overall, we did not do the right thing. We kept, in general, most states kept schools closed for way too long.
Could I interject and just say that I feel that the school closures and reopening, a lot of the success rates were actually due to compliance with families. Because if you want to reopen and have every child tested and every single parent is complaining and saying that that's violating their rights, then now you're hitting a hurdle. But for example, we had schools that were smaller and were able to come up with certain guidelines to return, and because there was a smaller group of families that all agreed and were compliant, they were able to get through and open up the schools and do everything that they needed in order to get the kids in, no matter what it took, no matter what the guidelines were that were designed by the school, because the parents were compliant and everybody was going with the guidelines. So I think that's also another problem. If you're going to have hurdles and you're going to have resistance, you're not going to be able to have this smooth process where you can reopen right away. And I think that's why the response was so different, not across states, but across counties, across towns. In Miami, it was literally across neighborhoods. We had different responses in different schools.
No, I totally agree with you. And I think the message we didn't do right is also we didn't do the right message that in order for businesses to open, we had to get kids back in school because that's the only way for parents to go back to work. So the critical component of how important schools opening is for reactivating the economy, we just didn't make the connection. And that was a critically important connection in my mind.
But I think it was also important to bear in mind that if we look at influenza as a model, schools are perhaps the great melting pot now for disease transmission and maintenance of transmission in the community. So certainly the rationale for closing schools initially was there. I think to everyone's point that, how long to stay closed, well, that really depends on our community's ability to block transmission other ways, masks and vaccination.
Right.
Thank you so much, Dr. Alexander. Thank you, Dr. Constant. Thank you, Dr. Del Rio. So many points that are so important to talk about.
Olga, that was an important discussion, but it wasn't just the children who were isolated when they were kept out of schools. Adults were also told to stay home and quarantine.
And there is disagreement over whether that isolation period was too long or even needed at all. Here's another side of the debate. Take a look.
I think one thing we have to keep in mind is we lost over 1 million people in this country. COVID was real. It was very, very dangerous. We got very tired of the quarantine and everything like that, but I absolutely believe that it was necessary in those circumstances. And my big hope is that the public does not turn against drastic measures that have to be taken for future pandemics when and if they come.
And Dr. Zinner, another woman that we interviewed believes the cost of quarantines and the isolation it caused was too high. Take a listen.
And I have a really personal story that I think we could do much better on any other type of outbreak, but particularly in COVID-19. My mother was one who was in an assisted living home. She never got COVID-19, and yet people in her home were isolated to their rooms for over a year. And I had to talk to my mother through the window glass. My mother did not die of COVID. She died of being isolated. And I think for older adults, isn't there a better way that we could handle these problems? And for the families who have to stand outside of a window and talk through a window to patients or their relatives and loved ones who are not sick, there's got to be a better way. I hope you have some comments on this.
So sad. And I heard many of those personal stories, Dr. Zinner. And add to that, how many patients died alone in the hospital?
Dr. Del Rio, yes, it was heartbreaking. But when it began, we didn't know what we didn't know. So what have we learned so that the next time we can make allowances for situations like this?
Well, you know, it's always easy to look back and say we should have done this, we should have done that. But as you said, I think when we were, you know, in the heat of the moment, you're trying to do the best you can, and it was, you know, it's still very, very present in my mind how scary it was, how many people were coming into the hospital and dying. That initial wave was incredibly severe, and we didn't know what was going to happen. I think, you know, Michael, back when we started doing this program, if you and I had said over 1 million Americans are going to die, they probably would have said that we were crazy, right? And the reality is we have to realize the enormous toll this pandemic had. Even if we did many things that you say, well, we should have not done this, despite all that, there was a tremendously high mortality. I think we need to be very patient-centric. I think one of the things that to me was really hard is this isolation that this lady was talking about people. Patients in the hospital who couldn't be seen by their relatives. People were alone. You know, we were trying to people, you couldn't go into patients' room. I think we could have done better. I think we could have, now we know the transmission. I think we need to understand better the transmission of respiratory viruses. But at the end of the day, if we do it correctly, we will be able to stay uninfected. I mean, I saw hundreds of patients during the pandemic, and I did not get infected in the hospital. I got infected, you know, in June of last year during, you know, a social event. So at the end of the day, in the hospital where I used my appropriate PPE, I did not get infected. And we did not do that to allow family members to be together and to be able to have time with others. So I think preventing isolation, as was mentioned previously, at all levels, I think is going to be an important part of our pandemic preparedness plans. How do we decrease isolation of individuals both sick and exposed?
Thank you, Dr. Del Rio. Dr. Alexander, I would love for you to chime in on this as well, because I find this to be very important. There were so many heartbreaking stories.
It is, and it's, you know, 1 million lives is nothing to sniff at by any means. And it becomes very personal. One of my best friends lost her father due to COVID, probably a transmission at home from a family member. So, you know, I think to Dr. Del Rio's comment, masking, social distancing, that worked. And, you know, we didn't see the onslaught at many of our hospitals the way they experienced in Italy, the way they experienced in the state of New York. So the social distancing and the masking, as painful as it was, worked. The flip side is that, as was pointed out, you know, social distancing for many people became social isolation. So as we prepare ourselves for the next inevitable pandemic, I think this is part of what our considerations are going to have to be. How do we care for one another without being in each other's faces?
Dr. Constant,
Agreed. And I think that's possible. I'm sorry.
I was just going to ask you to comment on this, because it's the grandparents and the grandchildren that also were separated during this period of time. And I'm curious for you to share your comments with us about what you saw.
Well, I mean, this was very difficult. And for me personally, you know, I grew up here. My husband did as well. So we have both sets of grandparents. We've got tons of grandchildren. And I'm a physician, and my brother-in-law is a physician. So, there was no way we were going to see our parents. The grandparents were totally isolated. There was no discussion about it. The idea was myself or my brother-in-law would be patient zero, as we were seeing sick patients every single day. We were not staying home. We were not working from home. We were going in every day when the streets were empty and we were terrified of this virus. And that did cause a lot of tension. And this discussion came up pretty much 3-4 times a day, every day. And we stood firm. And, we told them that you've gone through so much in your life and you've suffered before and you've gone through bad times and you will get through this and it'll be okay. We'll make it out on the other end alive and you will see your grandkids. And it's not going to last a decade. It's going to be at most 2 years. I mean, we just said all of that. Just, we're going to have to grin and bear it and get through it. I would rather that than lose my family member. And we just had to reiterate that point over and over. So, I'm not insensitive to the fact that it was very isolating. It was very heartbreaking. Personally, my mother's a widow, so she was home alone. But I didn't mind. I said, I'd rather you be home alone and speak to the kids through a camera than me lose another parent. And that's just the harsh reality. So I think that, the discussion is we have to be less short-sighted. I think everybody was short-sighted and they didn't understand that this was for the greater good. And if we made it through on the other end, we'll look back and just say, we dodged it. Nobody in my family has got COVID. I still have never had it till this day.
Wow. Good. Wow. Thank goodness for that, Dr. Constant, because we have both received COVID.
Scarlett, that was so important. Thank you very, very much.
So, yes.
Olga, I want to change the subject a little bit. It wasn't only quarantines and isolation that took a toll. Misinformation and disinformation was also a problem.
That was a huge problem. In fact, the Johns Hopkins Center for Health Security did an estimate on the toll this took in terms of lives lost and harm done. This is important. Take a listen.
We estimated that in late summer 2021, misinformation and disinformation caused 2 to 12 million people to be unvaccinated. And that caused about $50 to $300 million of harm per day. Every day during that time, our estimates were that misinformation and disinformation were causing 15 to 90 COVID deaths, and that has a lot of cost.
Dr. Zinner, I remember you could change the channels on television and you could also look at different social media sites, and the information was different, and many people were, just scared and confused.
Olga, I tell you, I was shocked that we didn't follow the science and began to distrust our established institutions that we had relied on for decades. Dr. Alexander, I'd like to get your opinion on how disinformation caused many people to not get a vaccine or get a booster, and did we do enough to counter this?
Well, you've raised, I think, one of the key issues and one of the most challenging lessons in the pandemic. And let's be honest, right? We all appreciate that religion and politics are bad bedfellows. So is public health and politics. And as a consequence, politics got moved into public health got moved into the realm of politics. And then what goes out the window is trust. And it's widely accepted that the single greatest requirement for immunity in the community is trust in the community, that people aren't going to accept vaccination until there is trust. And when there are disparate voices speaking, especially voices that probably don't have expertise in the discussion, there's a lack of trust. And that is probably the single thing that not only leads to a lack of vaccination, but as was referred to earlier, costs us lives.
And Dr. Constant, speaking of trust, according to a UCLA study released earlier this year, there was a lot of hesitancy in the beginning in Black communities about the vaccine, and not only because of disinformation, but also due to the lack of trust in their healthcare experiences. What can be done to rebuild that trust in the future?
Well, I've thought about this throughout the 2.5 years that we've gone through this pandemic, because there was the mistrust in the Black community. But as a pediatrician, what I saw overall was mistrust amongst everyone. And so it's twofold. So we know historically the Black community has always had a low level of trust for physicians due to, historically certain things that were happening, and that there's this idea that they're not being looked out for, and they're not their best interest is not really in mind. And so that's one side. But on the other side, unfortunately, as physicians, I believe that we did a terrible job communicating. And I think that we were not a unified front. When you have your two parents arguing about things and one parent says one thing and the other parent says something else, and you don't trust either of them. And so in the medical community, we were not unified. We were not conveying the same message. And then furthermore, we were not communicating well. Instead of saying things like, medicine is very fluid, nothing is absolute. For now, this is what the studies have shown, and it may perhaps change. Instead, we were saying, do this, do this, do this. Oh, never mind, that changed. We're going to go do this, this, this. And right there, that just creates uncertainty within the community. And I found that. And, patients personally would ask me, doctor, I trust you so much, but I just don't know who to believe anymore. And that's really sad. And that's not their fault. That was our fault. We did that. So I think that we could do much better next time at communicating, explaining how non-absolute medicine is and how things are constantly changing, and we're constantly reading studies, and we practice evidence-based medicine, which I don't think any of us have ever mentioned before in the office, just to let them know this is how we come to conclusions, because they really think that we just have like these guidelines and these medicines and these treatments that we have, and we just use them all the time like a blanket. And rather than explain to them, like, no, we actually read studies and they change throughout time, and we modify our treatments or we improve them, or, we just need to be more communicative. And I think that definitely physicians need to have a unified front. I heard many different points of view about the vaccine from all different branches of medicine, and it was terrifying.
I agree, Dr. Constant, and in fact, it's an important point, right? In politics, if you change your mind, you're flip-flopping, and that's bad. In medicine and science, if you follow the data and change your mind because of the data, that means you're smart.
I got to tell you, I agree with both of you on that thing, but let me bring up something. Dr. Del Rio, the public believes there was a lot of confusing information that was coming from government sources. Why do you think that happened, and how can we make sure that doesn't happen again in the very context of what we're just talking about?
Well, again, as information is evolving, people say, well, the information is conflicting. Yesterday, you told me masks were necessary. Today, you tell me masks are necessary. Yesterday, you told me that you need to clean carefully all your surfaces. Your groceries need to be cleaned before you bring into the house. Today, you're telling me that's not a mechanism of transmission. So I think, that creates, as was mentioned previously, that creates a sense of uncertainty and confusion. I think we were not good to communicate of saying, this is what we know, this is what we don't know, and this is what we're doing to find out what we don't know, and we'll tell you later. We were not able to say, this is what we don't know. And I think it's really important to over and over communicate uncertainty. And you have to communicate uncertainty with a purpose, saying, because we don't know if the virus is airborne, we're doing the following studies in order to determine that. Instead of saying, oh, no, it's not airborne, and then you come back and say, well, yes, it is airborne. Those are the kinds of things. Being an absolutist, I think it's counterproductive. So really, I think a good lesson in communication is really, how do you communicate tentative information and with trust? How do you tell people, look, this is what we have right now, this is what we're doing, and we need you to help us advance this, and we need trust. And it has to be done through the appropriate channels in the community. I remember in a community in South Georgia talking about vaccines, a person said to me, you, Dr. Fauci, you can tell me everything you want about getting a vaccine, but until the fireman sitting right next to me in the pulpit at church gets his vaccine, I'm not going to get my vaccine. So the trusted source of information for that woman is that fireman who's an EMS in her community. That's the person she trusts to take care of emergencies. So we needed to work through the appropriate, agents of trust in the community in order to get the message out.
And Dr. Del Rio, I want to piggyback on something you said, because I just got a question from a viewer, and the question, and I'm gonna pose it to you, and help me out here, Dr. Zinner. Can I throw my masks away? Because that was a big one. Wear it, don't wear it, it works, it doesn't work. Dr. Zinner.
Well, so we are going to turn to Dr. Rio, but let me put this in context and maybe oversimplify it. So the masks came in two varieties that we really dealt with. Those that protected you from the environment, like the N95s, and those like the surgical mask, which protected the environment from you. So, Dr. Del Rio, I'll be curious about your comments in there, but I'm not sure we're quite ready to throw away our mask yet.
Well, I'm certainly not throwing away mine, because when I go to the hospital as an infectious disease physician to take care of people with respiratory illnesses, tuberculosis, influenza, and many other things, I'm wearing my mask. I'm wearing my protective mask. And there may be other situations where I may be in crowded environments with multiple people. I'm going to wear my mask. I'm certainly not wearing my mask all the time like I did in the past. And I think, part of it is you look at the evidence, you look at the number of cases, you look at how transmission it is. We don't have a lot of people in the hospital. I'm vaccinated. And, I tell you, looking at people's faces, the other day in clinic, I was seeing patients without a mask. It's wonderful to be able to talk to people without wearing a mask. It was easy to communicate with my patients, much better than I had done in the last 3 years. So, I think it's a little bit like, do I throw away my umbrellas just because the storm has passed? No, there may be a storm later on. You want to put your umbrellas away because you may need them later. But that doesn't mean, we're done with them.
Thank you, Dr. Del Rio. Dr. Constant, I'd love for you to chime in on this mask question as well, if you don't mind.
I was hoping you didn't ask me.
Oh, come on. I want everyone to chime in on this one.
I think that, so in the pediatric world, we finally got rid of the masks. We're not wearing them in the office at all. And then I think, unfortunately, we just went back to normal. As a pediatrician, we're exposed to so many respiratory illnesses all the time. I mean, it's been 10 years that I've exposed to the bird flu, H1N1, everything. And so when we got rid of the masks, I really kind of just got rid of the mask. I see COVID kids, I see flu A, B. Sometimes I have strep and COVID at the same time. And they're like, doctor, do you want to run out? Do you want to close the door? And I'm like, oh, I'm okay. Don't worry about it. So I have not been wearing it. And the patients, for the most part, if they are febrile, they are very good about wearing their masks. If they are coughing and sneezing and they know they probably have something, they come in wearing a mask, which is very courteous because it protects me from them. But for the most part, I have not been wearing it. Maybe in the fall, I'll go back.
Dr. Alexander, we're not going to let you off the hook. We want your response, too. This is not an easy question for us. We just, at my institution, went to masks being voluntary. But I'm curious where you stand on this.
We've done the exact same thing here at our institution. We made the decision to make masks voluntary. I think it's important to remember that masks work. And so the decision to use them was the right thing at the time. Now, as Dr. Del Rio points out, the storm has passed. You can put your umbrella away, but don't throw it out. There's going to be resurgences. There's going to be other COVID variants. And, other forms of viruses. Influenza, pandemic flu is knocking at our door.
But that's why we have a panel, because we can get everyone's opinion, which I love.
All right, here's another major issue. After 3 years, we still don't have a definitive answer on where the virus came from.
You're right, Dr. Zinner. So let's ask our two infectious disease experts, starting with Dr. Alexander. Your thoughts on this information, and really, how important is it?
So that's the key question. Is that important? So I don't think we'll ever know for sure whether, where this came from. We don't have to postulate a laboratory release, be it intentional or accidental. Coronaviruses emerge all the time. But I think the big point is, no matter where it came from, we have to be prepared. And that's where we fell short.
How about it, Carlos? How important do you think it is to know where the virus originated?
Well, I think it's pretty clear that it originated in China. That's where it started. And, knowing how this viruses behave, it's likely that, jump from an animal from a bat to an animal and then into humans. Whether this was a laboratory or not produced virus, I think the evidence overwhelmingly points that this is not something that was produced in a laboratory. This is likely what the worst enemy we have in the production of viruses and zoonotic infections is the environment we live in. And we need to realize that, animal health, human health, zoonotic infections are the most common infections nowadays. We're going to continue to see zoonotic infections, which is infections in animals that come into humans. And they occur for a variety of reasons. Number one is, we're living close to these animals. Number two, the populations have exploded. Number three, climate change. So at the end of the day, we need to have a better approach to zoonotic infections rather than saying where this came from.
And Dr. Del Rio just said it came from China. Some people say we don't know where it came from, but no matter what, we have to keep in mind that the virus is still with us and will be with us.
You're right, Olga. But Dr. Alexander, will the virus keep mutating to new variants and subvariants?
Yes, absolutely it will. This is what viruses do. Viruses don't function personally. Their sole goal is replication. And so what we will see is the gradual evolution of this virus, just like we see with other viruses. Influenza virus is another example of a virus that keeps changing its wardrobe so that it continues to affect us.
Keeps changing its wardrobe. That was wonderful. Thank you, Dr. Alexander. This new subvariant has a new symptom, and we have a comment on this as well. Take a listen.
I've heard that the new variation of COVID is related to pink eye, and I wanted to know, is it still under investigation? Because I can't imagine if you have pink eye and you self-diagnose, well, I've got COVID because I've got pink eye. I think that would probably be not a good idea to do.
Dr. Constant, pink eye is so common in children. Why don't you share with us what is it, and any thoughts about why is it showing up as a symptom for COVID?
Right. So yes, it is a common illness in children. Conjunctivitis is usually in viral etiology. So you get some type of virus, and then one of the complications with that virus is going to be the conjunctivitis. So it's not unheard of. It comes with all the other coronas or the adenoviruses or the enteroviruses. So again, this is another form of communication where we could do better. We could explain in the first place that conjunctivitis is inflammation within the eyelid caused by a viral illness. Any of them, pick a name, and that's what causes it. So the fact that now it's associated with COVID-19 is not terribly surprising, and the treatment would be exactly the same. Treat the virus or the symptoms caused by the virus and go ahead and treat the conjunctivitis. So again, yes, that was happening. Now, the interesting thing was down here in South Florida, I don't know if you remember, there was just like a month and a half where everybody had terrible conjunctivitis, but the pollen count down here was unprecedented, and we were all suffering from allergies. So all of these people were running into the office and freaking out for conjunctivitis, but really a lot of it, at least down here, February and March, it was allergic conjunctivitis, and it really was just like a symptom of allergies. So all in all, the overall message is that conjunctivitis is very common, no matter what the etiology is. Just, bring your child to the doctor. We'll figure it out, and we'll treat it almost the exact same way.
Olga, while people are still coming down with COVID, the majority of cases so far appear to be pretty mild. Let me tell you about my experience. So recently, I took the first international travel that I'd taken since COVID to a professional meeting, and when I came back, I thought I had a cold. But because I knew the next day I was going to have to go to a social event and interact with people, I said, well, let me test myself. Turns out I was positive. But I think that's what it's going to be like. A lot of us are just going to get a cold or the mild flu, unlike what we saw at the beginning of this pandemic, which was so dramatically different.
No doubt. And I think we can all agree that's because of the vaccine and its rollout that got so many people vaccinated with at least one dose. Take a look at the numbers here. Over 80% of Americans have received one dose of the vaccine. But when you look at how many people got the booster, those numbers really drop. Less than 17% of the total population have theirs. The number is less than 18% for 5 years and older, and lower than 43% for those over 65.
Dr. Del Rio, how do we get more people to take the booster?
Well, that's something that, I'm more interested than anything in getting our patients over 65 to get their booster, because that's the population I'm most worried about. One of the things is, the immunological wall we have built against this virus is not only vaccines, but it's also a prior infection. And this is another when we talk about mistakes we made. We told people, oh, prior infection doesn't protect you. Prior infection doesn't protect you. Well, it turns out you get some protection from prior infection. You get the best protection from prior infection and vaccination, or vaccination and infection. That hybrid immunity really gives you some of the best protection. However, we have enough people in our country and globally either vaccinated or infected that, estimates are that over 90% of the population has some degree of immunity. The problem is that immunity wanes over time. It goes away, starts waning over time. protection against infection wanes very rapidly. Protection against severe disease, hospitalization, and death wanes more rapidly if you're older, if you're over the age of 65. And that's why we need to get people over the age of 65 to take another booster. And that's really going to be a job for primary care physicians, for family doctors, for people, for Medicare. We got to get those patients over 65 get a second booster. And I really think that should be one of our priorities over the next several months, because the reality is we're still having about 1,000 to 1,500 deaths in our country per week. And those are happening, the great majority of them from COVID are happening in people over 65 who have not been boosted at all or were boosted many, many months ago.
Dr. Constant, let me bring you in, because even though blacks and Hispanics lagged behind whites in getting their first dose of the vaccine, they did catch up, but they're still behind in getting the booster. You mentioned this a few minutes ago about that communication, the messaging. Is all of this because of just bad messaging, COVID fatigue?
COVID fatigue, 100%. Sometimes I don't even bring it up in the room because I just know I'm going to get a big eye roll and a sigh. I mean, people are exhausted. And I think what I believe I saw for the most part in the Black community was, the initial vaccine or the initial 2 doses, that was just to get what we need to get in order to get our kids to school and back to normal. I need to get to my job. My kid needs to go to daycare. They're telling me I need a vaccine. Let's do it. Let's get it done. And I think once that level of intensity went away, and the requirement wasn't there anymore, it's kind of like, oh, okay, good, so nobody's requiring anything of me, all right, let's keep it moving. And so this idea of getting vaccinated because it creates herd immunity, and as a community we need to pull together and all vaccinate, I mean, that was definitely not on anyone's mind. We know that message was lost. So those that did it to get it done, to move on to the next step. And I think that unfortunately, that's why, the booster or even the second booster by now has kind of fallen by the wayside, because I think everybody just feels it's not necessary. So why would I go do it?
So I'm just curious, Dr. Alexander, should the COVID booster become one of the annual immunizations for children? Your thoughts on that?
So this is the direction we're moving. And again, there's 2 reasons to vaccinate children. One is to protect children themselves, but if we think carefully, and again, Dr. Del Rio expresses concern for care of the elderly, who's taking care of the kids after daycare? It's often grandma and grandpa. So I think there are compelling reasons to continue to vaccinate children. I think we also have to remind ourselves of 2 important things. The fact that you need a booster doesn't mean it's a bad vaccine. This is the nature of the virus. This is the nature of our immune system. And remember, it's a truism in the world of vaccination that vaccines don't always prevent infection, they attenuate disease. So the goal of our vaccines is not always to prevent people from getting infected, it's to keep them out of the hospital.
Thank you, Dr. Alexander. So I have a question from a viewer, Dr. Zinner, and I want our panel to chime in, and you as well. It's very simple. She asks, what about the mRNA? I'm still scared of it.
Well, I'll tell you, Olga, I think one of the great things that happened during the pandemic was the development of RNA technology. And RNA technology had been in development for a very long time, 20, 30 years, and certainly over the last decade. And the rapid development of a COVID vaccine was the result of all of that occurred in the previous research. mRNA technology is about to change many of the ways we're approaching things like cancer and other forms of communicable diseases. We just heard last week, for example, that there's a vaccine now against one of the worst kind of cancers that ever existed, which is pancreatic cancer. A vaccine against a cancer that had a signal and a positive effect, that's a remarkable achievement from this mRNA technology. I'd like to ask all of our panelists, and start with Dr. Del Rio. Dr. Del Rio, your thoughts about this technology, mRNA technology, and where we're going with that.
Well, first of all, Michael, I want to reassure the viewer who's afraid of mRNA. Don't be afraid of mRNA. It's in every single one of your cells. mRNA has been with us for billions of years, and it's found in every cell in your body. So don't be afraid of it. It's part of who we are. mRNA, the way I think about it, is simply a way of transcription of cells to reproduce It's the messenger. That's what the M comes from. So we're using that technology. The technology is not new. This technology was invented by biology and by evolution billions of years ago. We have learned how to use this technology to then take a piece of a nucleic acid from a virus or from a malignant cell to put it in there to stimulate our immune system. In fact, I really think it's a wonderful technology because it's more similar than what happens in nature. You're taking a small piece of a DNA, of an RNA, of a bacteria, of a virus, of a cell, like a cancer cell, and you're exposing the immune system through it. And simply what the mRNA, what the messenger is doing, is taking it there. It's a message. The way I think about it is, this is like the plug and play technology. This is you're afraid of cassette players. You're putting the cassette in there, and sometimes you're going to play classical music, other times you're going to play rock, other times you're going to play jazz. Depends what cassette you put in there. But the technology doesn't change. You don't change your VCR, your player at home because you change the kind of record you're going to put in there. You use the same machine. This is the same thing. So it's an incredible technology. The incredible development is that we were able to learn how nature does it, and we're able to copy nature in order to use it to deliver a vaccine. That, to me, is the amazing thing. But this is not new. Biology invented mRNA technology billions of years ago.
Thank you, Dr. Del Rio. And Dr. Constant, I want your thoughts on this. And it's just amazing when you all just explain it in simple terms. People get it. They just get it. And the fear just diminishes.
Yep. Exactly. I just I gave a much shorter and much simpler version of what Dr. Del Rio just said almost every single day in the office, because if you don't make it clear, then it's just this unknown and it's terrifying. This mRNA, what is that? And you're injecting it into my body and then it's going to change my DNA. I mean, people were terrified. And so again, it's amazing technology, and I would talk about it and get excited in the room when I spoke about it. But that's what you have to educate. Most of our job is educating and advocating for our patients, but educating our patients so that they can make an informed decision, not just push it down their throat and tell them that this is good for them and it'll end everything. We really have to explain step by step what's happening. And the mRNA technology was great, and honestly, it opened up the conversation for vaccines in general. I started explaining the difference between that and regular vaccines. I mean, most parents don't even know what the vaccines are and how they work. So I would go through each one, a live vaccine, and live non-attenuated, everything, and just explain to them what is happening and how you attenuate disease rather than prevent from getting a disease.
And Olga, I would just add for a second that explaining this is very important. And one of the most exciting things that I did during the COVID pandemic is when the producers of Family Guy asked me to help them develop, the science behind a clip they did to explain, this technology. Because again, they were able to get it in a way that people understand it, which is through cartoons, through something they trust again. Family Guy is trusted by millions of Americans, and to get the information through them was really important. And the producers really understood how to do that. And again, it's at the end of the day how you explain it to people that makes a difference.
Mm-hmm.
Dr. Alexander, I do want to bring you into this discussion. I mean, for example, when we first heard of mRNA technology, I heard among my patients how frightened they were of this and the conspiracy theories around what it would do to the body and all kinds of changes. Clearly, you must have seen some of that too in your experience. Can you share that with us?
I saw a great deal of it. And let's step back a notch. And to Dr. Del Rio's comment, our accomplishment with the COVID vaccine was a veritable Manhattan Project built on decades of scientific research. So as Dr. Del Rio points out, the biology is not new. The biology is billions of years old. Why was there concern? This is something we see with every vaccine, right? And in fact, as there are anti-vax concerns brought out, this is just one of the predictable questions that comes out with virtually every vaccine. And I think one of the things that Dr. Constant can share with us is that the decision to vaccinate, you can give people facts until you're blue in the face, that the decision to vaccinate your family, yourself, is in large part an emotional decision. And what we've got to do is tap into people's sense of emotion and the the genuine desire that people have to do what's right and lead them that way.
Thank you, Dr. Alexander. What a great discussion. We have about 6 minutes left, and I want to get final thoughts from everyone. But before I do, I really want to get this question in, and if everyone can chime in briefly. I love this question. You know, the pandemic changed our world, Dr. Zinner. Many people started working from home. Now there's hybrid. And one woman writes, I love working from home. It's a big plus today. Parents are home now more with their children. Dr. Constant, what are your thoughts on this and the situation of some people really not even wanting to go back?
Well, you know, amongst my age group, this really happened even in my own home. My husband is now home indefinitely, and most of my friends that work in finance and in the business world, they're home or hybrid. And we talk about this a lot. And I will say this, at least for my age group with younger children, it's had a negative effect because you are physically around all the time, but mentally you are not. You are always on the phone. You are always returning emails because when you're working from home, there's no end. There's no 9 to 5. There's no checking out. There's no getting up and putting it away. I mean, it was already like that before, but now more so than ever, you're accessible all of the time. So everybody is home and quote unquote spending more time with their families because they're sitting in front of them and in front of their face. But I can say at least amongst like my generation and my young families, everybody is totally plugged in until they go to bed, which I think is a little scary.
Dr. Del Rio, I'm curious of your thoughts on this. Particularly, you and I both run health institutions similarly, and our entire back office is at home. And I'd be interested in sharing your thoughts on this too.
Yes, Michael. I mean, I think that those that are in the front lines, you know, in the hospital seeing patients and in clinical care and patient-facing activities and research activities are there, but a lot of the people who are not in those activities are home. I personally have required that my staff, come in and come to work at least 2 days a week, and we try not to have Zoom meetings those days. We try to have on-person meetings. We have to have discussions. I think there's still a very important component to be in the office to have those personal discussions. We get a lot of work done when we do that. A lot of work that wasn't going to be done in Zoom. And I agree 100% with Dr. Constant. I see, one of the things with working from home, it has really broken that barrier between what's home and what's work. And that could potentially be, you can work all day and all night, or you can ignore it all day and all night. So I think we also need to adjust to that new reality. If you're going to be working from home, when you're working, and when you're not, you're with your kids and with your family.
So many good points there. Dr. Alexander, your thoughts on this one?
So it's like everything else, right? It's a stress on our society. It's a stress on our families. And stressors can do damage. They can also bring us together. And I think that COVID has also built relationships. If I look at what happens with me and my professional colleagues, there's been an intensity of relationships, camaraderie, trust, hard work. So it's like everything else. Nothing is either all bad or all good.
Thank you so much, Dr. Alexander. We'd love to get everyone's thoughts about what we've learned from living and working through the pandemic, and if we are prepared for another major disease outbreak.
Dr. Del Rio, let's start with you.
We got about a minute, sir.
Well, we learned, in my mind, the most important things we learned is that science is important. Science got us out of this problem, and we need to continue to support science. And we also learned how amazing my colleagues in medicine and public health are, because, at the time of this pandemic, they came to work, they took care of patients, and they did not flee, they did not hide. They were right here, right in front of the patients. So I'm very thankful for the healthcare workers that we have.
Thank you, Dr. Del Rio. Dr. Alexander, your final thoughts here, please?
We weren't ready, but we know what it takes to be ready, and this is the discussion we need to have as a society.
Short and sweet, great soundbite.
And Dr. Constant.
I think this, like every crisis, you can always learn from it. There's no right, there's no wrong. You just think about what happened and you learn from it, and we just do better in the future.
Because we know more today and we can do better. Dr. Zinner, I'd love your thoughts. You went through the pandemic at Miami Cancer Institute with 1,200 patients coming in every single day, 1,900 employees. It wasn't easy.
Well, Olga, I'll tell you, when this started, I think we all underestimated the global impact. We did some things right and we did some things wrong. For us who were dealing with patients in the front line, we had to figure out a new way of handling those patients who were immunocompromised, for example, the cancer patients, and those patients who were coming in with family members. We wouldn't allow the family members in, but we've learned over time how to deal with that. Now, as for the future, we are better prepared, and now we have tools we never had before, just in case something like this were to ever happen again.
And we talk about that a lot, about something like this happening again. Everyone out there is saying, I hope not. But between Dr. Alexander and an entire panel, it seems like it's a possibility, Doctor.
You know, unfortunately, we live now in a communicated world that we can easily get something from overseas very quickly. Is there something we can begin in the Northeast that spreads very quickly to the Southwest? Unfortunately, because of that communication and all the good things that come with that, we are probably going to face another epidemic and maybe pandemic.
Thank you so much, Dr. Zinner. I want to bring in our panel. I just want to thank all of you again for your time. Dr. Constant, Dr. Del Rio, and Dr. Alexander. As always, thank you for your knowledge, your opinions, a great town hall. We are very grateful.
I, too, want to share a thank you for being part of this important town hall. This message is not going to change. It's going to stay with us. I'm afraid COVID's going to stay with us. And we're going to all learn how to adapt to it as something we have in the future.
And to our viewers, we hope we answered all of your questions about where we are, what we learned in the last 3 years, and whether we will be more prepared to face our next outbreak, if there is one. Thank you so much for joining us. I'm Olga Villaverde, and on behalf of Dr. Zinner, we wish you a wonderful evening. Take care.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.